So I help you learn. So welcome to PNR 204 Pediatric Nursing. You're at the, second half of your nursing journey. So congratulations for getting there. And I know how difficult it is to get there. I am Professor Bogart, and I started with Fortis in 2017, and I started on campus in Cutler Bay, which is in Miami. I live about 30 minutes from the Keys, and I've been in Florida since the early 80s. Originally, I'm from New York, so I know what cold and the seasons are, but I prefer to be here in Miami and keep warm most of the time. When I started into Fortis, I taught pediatrics, where I have over 25 years experience in. And they also had me teach pharmacology, which I said, oh, I guess I could fake that course. So I went in and started teaching it. And actually, I loved it and enjoyed it. One of the things that is my strong point is dosage calculations. Miss Aviles will tell you because I had her in that pharmacology class, and I make it understandable. I will send you some recordings today. If you need that help, I only need about 15 minutes of your time. Okay, and then you practice. And then you can come back to me 15 minutes of your time. I don't need hours. It's just I make it so understandable that I will help you not miss any 2 points on any exam. And I think that's important because that's 10 points on your exam if you don't know your math, and it can fail you. And we don't want that for nobody. Okay? Anyway, so
Yes.
I teach a little bit differently. What I do is I do a lecture per se. If at any time you're not understanding, I want you to stop me. I'm never offended you interrupting because probably somebody else has the same question. I think I explained very simplistically, but if you don't get it, please. I don't want to sit here and go blah, 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 and you're not understanding. When I'm done with lecture, I have made a lot of Kahoots. And Kahoots are a game we play, and it tests you immediately on what you've just listened to. So it is that repetition, and it does help. Yes, we do exam reviews. I've got some good handouts for that. If you ever need any special one-to-one tutoring, just let me know. I mean, I am available on our work with your times, whether it's with one person or groups of two or three. It's okay with me. I'll work to help you. My goal is for all of you to get through pediatrics and go onward, okay? And I will help, but you have to ask, all right? Today, we're just going to briefly go over that PowerPoint sent by Dr. Brown, the rules of online. I'm going to tell you those nitpicky things that you really need to understand well. And then we're going to do a PowerPoint. It is long. So I'm going to try to, I don't read a PowerPoint. I don't just tell you the concept that I'm seeing on each slide. Okay. So I'm not going to be reading and boring you and put you all to sleep. Then, when I'm done with that, I'm going to do the Kahoots and we'll be done with today. Now, I have a question. It is Friday. It is for most of you who are on Eastern time, 6 at night. We're getting out at 8:30. Now, I can do a break in the middle of class for 20 minutes, or I can get you all out here early without a break. Minded, if you need to go to the ladies' room, you need to get something to drink, you need to go answer the door, or your kid's running and needs help, I understand that happens as long as you come right back to class and continue to listen. Do you want a break or do you want no break and get out early?
Go
No
straight
break.
through. No break.
No break, please.
Okay. All right. Sounds good to
Break,
me.
break.
I mean,
No
most of
Yeah,
break.
that was
you
Jody.
do that. It's Friday night and I understand that. So, all right, let's get going with where we are. Um, Great. So everybody still has all their names on properly. So this is the slide that Dr. Brown made this quarter for online nursing. It's PNRN. They're the same rules for each. So you might see RN on this, but it doesn't mean it's RN. It's RN or the PN because we're both professional nurses, aren't we? So remember, when you come to class, this is like going to school and going and sitting in a classroom. So I know that we have one student who's ill today. I get that. I don't want to make her uncomfortable, but most of the time you need to be sitting up and not laying in bed, okay? Come to class and be in a professional attire. You don't have to be in Fortis, but you don't want a tank top on and too much of the body hanging out, et cetera, et cetera. More professional. That's all I ask. Sweatshirts, you're up in, Ohio, please wear your sweatshirt. Keep warm. Now, I am the lead pediatric professor of the RN program, but I am also assist the lead PN professor, Professor Stills. So if you need anything, I'm always the first person to contact. Now, if you need to, you can talk to my lead, Professor Stills, or you may go to Dr. Brown. Noted, I'm never upset if you have to go above me to do anything. Now, I do have a cell phone. It is posted on my announcement, the instructor. You can use it, but use it when you need me quickly. I do answer messages on Canvas actually pretty quickly or via emails. So if something's happening and you need it quickly, please just let me know. Why does this look paused? 1 second. Why does it look paused? All right, that looks good. That just really looked very weird to me. And I don't want you not to have your information. Okay, my cell phone, and I would program this into your cell phones right now, is 305 951 8055. And I tell you this because I want to know, for instance, if you're going to be late to class, or you can't go to class, or you can't get an assignment done and it's almost that time, or things are happening. I want to know before it happens. If you tell me after class, well, I couldn't make it because work kept me, whatever it is, or I had to run to the ER with whatever or whoever. I want to know as it's happening. Please don't tell me afterwards. That would be the most thing that you can't do for me.
Miss Bogart, you said 305-951-85. I mean 89.
88055.
Okay.
And it's also on my welcome page about the professor, okay?
Okay.
Now, most of you have already done, your initial work. Remember, there are two different discussion questions, one on you and then one about some information. Now, Dr. Brown's information is here. Be aware it's her first full name. Most of it, like me, is B. Bogart, but hers is Darlene Brown. There's actually another D. Brown in the Florida system. Also, that's her phone number, and she answered pretty quick. So if you need to, please, get a hold of her and for whatever you need immediate attention to. Always be respectful, right? Always know that we're all different. We all have different feelings. If you're communicating, communicate it in the most professional way that you can. Now, our class starts at 6 p.m. Eastern Time. 6:01 from now on, you will get 15 minutes late. And we know that you're going to have messages on 5%, 10%, 15%, and 20% late. You're going to lose the letter grade. Now, when wouldn't you lose that letter grade? Well, if you tell me before class you're not going to make it, and you show me why you didn't make it, whether it was you were sick, you have a doctor's excuse, an ER sign, a police report from an accident, whatever, it will be looked at. And usually with that documentation, they're not going to take away that letter grade because they'll sort of give you that time, okay? This week there's a discussion questions. Most of you have done it. Just make sure that you do it and then responses by Sunday. I've been asked, can you do it all at one time? It's okay as long as you are getting, that feedback from other students that really helps you understand the concepts because your discussion questions are really key. And many of those questions you'll see reflected somehow in your exams. One of the things that we do want to tell you about is academic integrity and plagiarism. They are really watching out for this. I did post something in your announcements regarding it. Just know that do your own work, okay? And many things I've seen is that you don't cite work in like your discussion questions. And I'm going to show you, I'll always write there's some sort of comment so that you can understand. I mean, many of you are probably going to want to go on in your careers to your RN, BSN, maybe even a PhD like me. Who knows? You never know, never count it out because I didn't go back to school for my BSN till I was 53 after 33 years as a nurse. So it can happen. So just know that how to cite stuff, and don't go to these crazy websites and try to get the information and cut and paste, or go to Google and don't cut and paste. Okay. So remember, because we are a professional profession. Now, here's some of those little things I was telling you about. These websites, Sudoku, Course Hero, Stuvia, and it goes on, Quizlet, it goes on and on and on and on. Be careful. Not only is Dr. Brown watching it closely and myself, but there is a team in Fortis right now that is watching for plagiarism and monitoring these sites. And many of these sites, you have to sign in. Now they got your name. Okay?
We supposed to be seeing something?
Yeah.
We only, well, I can only see.
Okay. Hold on. Let me go back again.
Yeah, the slides aren't moving to follow you.
How's this? Can you see this?
Yeah, now we
Okay.
can.
Okay. All right. Thank you very much for letting me know. I appreciate that. I told you something looked strange, right? So I guess that's what I was seeing. So thank you. So again, be careful. You know, first time you show something, there's warnings, but it can go up to dismissal from the college. All right? There has been students dismissed from the program. So be careful. I don't want that to happen to anybody. If you don't know how to look things up, please use me as a resource. I will help you. Try to turn your work in on time. If on Sunday you know you can't because you're sick, you got the flu, you got COVID, your kids have been crazy, you went to the ER, blah, 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 blah. Tell me before the assignment is due, and I will work with you as long as it's not every assignment. Okay. Say, hey, I had to go to the doctor, and you can show me something that shows that, and that's even better. And I'll give you more time because after 1 week, there is a 10% deduction. But with prior communication, I will work with you and I won't deduct. So, but your job is let me know. So after 2 weeks, it is completely a zero, unless there was some really crazy circumstances that were happening. Okay, but usually I've only seen actually one student she had to have emergency heart surgery. Okay, so that one did get some extra time to get her work in, but usually after the 2 weeks, 1 week you get your full credit. Second, minus 10%, and then it's a zero, which means you can't go back to week 3 and NCLEX questions and it's week 7. I cannot accept them. When you come to class, you saw me already very picky. Sign in with your full name and make sure your camera's on. One thing Dr. Brown hates, the fan on the ceiling. Some of the times you'll see that, okay? So be aware if we see that, you're going to be marked absent and you're not going to get credit for class. And we know absent too much can decrease your grades. I don't want to do that to anybody. So that's why I'm letting you know.
Professor Bogart,
Yes.
I just want to, I didn't know if you knew I finally was able to log in.
Awesome.
I'm at
Yes,
the
no, no,
library now.
beautiful. She let me know, and I'll make a notation why you're late and that, actually you had to go back to school for it. So, yeah, don't worry. Don't worry.
Thank
It's
you.
okay. Not a problem. But thanks. Another thing about online courses, not only do you get your attendance, you also get, they look at Canvas. And how many times did you go to Canvas and enter information, assignments and upload things? You need 2 points of uploading every single week. I mean, this week it's easy. You've had 2 discussion questions and your technology quiz, blah, blah, blah. You have already your stuff. But remember, if you work ahead, and you post it ahead, make sure every week there are 2 points of entrance, okay? Because if not, they can drop you without even talking to you first. Again, I don't want that to happen. I've seen it one time, all right? Because usually I'm pretty on top of it. We've already talked about the course and the 20%, and you will be getting letters for the whole thing. Earlier we were talking, some of you in 2 to 4 courses, make sure you keep organized. And again, I have NCLEX questions open, discussion questions open. Just don't post them till the week they're due. Okay? Again, because you need that point of reference of something documented into the Canvas shell. Okay? The one I will not open early is CJ Sims. That's going to be open on Monday at 12 a.m. and open till, actually, I keep it open for 2 weeks because it's 1 week with no deduction, 1 week with minus 10%, and then it is closed, okay? I do not send a lot of announcements. I'll tell you now. If I'm sending one, it's because it's really, really important. All right. So, because I know with how many classes, there are some slap happy announcement professors. I'm not one of them, just to let you know. Talk to me, talk to me, talk to me, talk to me. Communicate, 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 and you will benefit from it. All right. Make sure you read your syllabus, when things are due. Come prepared. It'd be good if you at least went over your chapters, come to class with information, questions, because if you come prepared, that's one time you've looked at information. Then I'm going to do a PowerPoint, review it again, and then immediately I'm doing that Kahoots. You have had 3 points of contact with it, and that repetition has been shown, you're going to remember it. Okay. So that's what trying to instill with you. I don't do quote weekly reviews. What I say, I open them up. Whenever you need help, ask for it, and I'll work in your time frame, okay? We do reviews for all exams, okay? And the HESI, I've got some great information for that. I was told that I just redid it again the end of last quarter for the December HESI, and it really helped the students. So I work hard on trying to give you those concepts that you will need. Again, tutoring, whether you need that dosage calc from me, whether you need, I don't understand this, let me know. I'll work with you 1-to-1, 2-to-1, 6-to-1, does not matter. Know that your KGA or those key graded assignments, objectives, they also call it, there are exams, quizzes, and your HASI. They're 80% of your grade. Your homework stuff or your subjective grades, your NCLEX questions, your practice exams, etc., all of those things are 20%. CJ Sims are counted very high. So try to do your best on them, okay? They're each 5%. It's a lot, all right? Now, this does have mental health as another program, but it's the concept I'm trying to show you here. Now, we don't have homework grades on now, but on week 6, we turn it on because we want to show you what homework you've done and how it's going to affect your grade. And by week 6, you're going to have an exam on week 4 and week 6, and you're going to have some quizzes in there. So then you turn on the homework, you're going to see how it will affect it, okay? And then on week 8, I turn it off. Know that you need a 78 on your key graded or your objective assignments before we add in homework. And I have seen students fail because their homework wasn't done. So don't be one of them. I will be notifying you. Need to get this in. It counts for this much. Please, you'll have till Sunday. Can I help you? Communicate with me, communicate with me. When you come in for exams and quizzes, come in on your phones. Make sure things are plugged in or you have your device or have them charged. I can't tell you how many times my battery ran out. And if you're somewhere where you don't have the battery, you're in the middle of an exam or a quiz, you are off camera, guess what? You get a 0. And I don't, again, want that happening for anybody, okay? So please, please, please use your chargers. Quizzes are 15 minutes, 10 questions. It goes forward. Again, it's on camera. Anytime you're doing a quiz or an exam and your electricity may go out, right? Storming's going on. If that happens, stop. On your phone, send me a message. Say, hey, my electricity went out. Stop. You will be able to do it again, to restart it. Those exams and Exemplify don't disappear. They're there until I say that they can be gone, okay? So don't be afraid, oh my God, I'm gonna have to do this again. No, you don't. It's gonna pick it up where you left off, all right? Again, everything has to be on camera. With exams, we're going to be doing the sweep and looking at whiteboards. I highly recommend you get a whiteboard because when you get to your NCLEX, they're not going to let you use a piece of paper and a pencil. Okay? So make sure that you have those things that they can erase. Exams is always one attempt. And again, something happens, stop, notify me, and we'll figure out a time to finish it. Okay? Now, some students like to do their exams on ground, at their campus. I need to know 3 days before. And you don't tell me. I want the professor, the person that can administer the exam, email me because they need to verify it because I have to send them the access code for that exam, right? Now, I don't mind you doing it on campus, but remember, if you don't take your exam on class, there is still class after. And I usually say with this class, be back at class at 20 after 7 because we will then start to do our homework, okay? Our lesson work for that day. So very important. You don't tell me who it's going to be. They need to email me. And it must be before the exam. We know all about the 360 and looking at everything. No hats, no earpieces in. Make sure your watches are off. We do look at those things. And remember, exams, if you just all of a sudden something happens and you don't show up, don't take an exam, that could be a 0 for you. If you tell me before because something's going on, we can work with that. But at minimum of not showing up, not telling me, it's going to be a minimum of 10% deduction. And I know what Dr. Brown will do. Okay, so be careful. If something's happening, again, communicate, 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 communicate. So exams and quizzes, we know it's through the modules. You get your grades right away so you know what's going on, okay? Let me know what's going on, any issues, and I can work with you. HESIs, we like that 900. And we are getting better and better HESI grades. And a lot of it is keeping up with, every week, making sure you're reviewing that stuff. I believe my Cahoots go over great concepts that you're going to be seeing later on. But that after remediation is when you get your final grades, okay? And again, homeworks. I've already gone over it once. Do your syllable, handed it on time, organize yourself for sure. And after 8 days, it's going to be a 0. NCLEX questions must be put in the proper format. I don't want that little green screen. I want to see it. That bottom right says print results. Instead of printing it, you change it to save as PDF. Save it to your computer and then upload it. If you don't do it right the first time, you'll see me put a 0 as a grade. It doesn't mean you get a 0. And in the comment, it's going to be attached an instruction sheet on how to do it. And I give you a chance to do it right. I'm not here just to give you zeros because you didn't submit it right. I'm here to help teach you do it right. Make sure you get at least a 78 on those NCLEX questions. You know, when you have 5% of your grade as your NCLEX questions and you have 4 of them, that's 1.25% for each one. And that can pull a 78.6 down to a 77. And you do not want that lower grade. So please try to at least turn in passing on it. I know sometimes you just want to get them done. Don't do that, all right? Because it will kick you in the butt later on, all right? We do have those RN practice exams, PN practice exams, same thing, case studies are through Evolve. You cannot go through the Evolve account. They must be done through the module. And it should automatically pass your grade into the grade book. If it does not automatically and you see a 0, let me know. I know how to go back and look for your grades, okay? And I can pull those grades out for you. CJ Sims must have 4 things on it. The top right must have your name. Top left is going to have which Sims that you were doing. And then in the middle, it's going to show the date, time, and the grade. Those 4 things must be there. If I don't see it, again, I'll put a 0 and I'll comment what's going on so that you can get me what I need, okay? They're worth a lot of percentages, so make sure you get at least your good grades on those, okay? The discussion questions, I've gone over them basically. You know, the one thing I see students not doing is in the body of the paragraph citing where it came from. Just make sure you do that, okay? And if you don't know how, I'm going to be showing you as we go along. Any questions about that? I think the one thing you heard was what? Communicate with me, right? Communicate with me, I can help you. No communication, I can't. And I don't want to do anything, you know, to decrease your grade because you're not talking to me. So we do have it's a long PowerPoint, but we're talking about growth and development. You know, how do children grow? You know, I find it very amazing that children are born as infants and they can't even lift their head. And by 1 year old, they've tripled their birth weight and they're walking or almost walking. And I find that unbelievably amazing. They go from a coo and a cry to na na, pop pop, mommy, right? And they're able to communicate. And I just think that's amazing. It's why I love kids. You know, I worked at our little hospital here. Well, it's a big hospital center, pediatrics. It's Nicholas Children's Hospital. And I worked in the newborn ICU, the cardiac ICU, the pediatric ICU, and the last 10 years in the emergency room. And I think actually the emergency room is what prepared me for you because I got to see all this stuff. And I got to actually see children that were not premature or cardiac or just sick. And they're growing. And actually, you see them, you know, a couple times coming in and out. Oh, I remember you and I remember you. So watching it. Remember, growth is continuous. It is ongoing and it's just unbelievable how quick it's done. And we can watch. Remember, the developmental, the way they go is, let's say, the gross motor skills. First, they do motor, gross, go, get up and go, go, go. That means movement, okay? Gross motor. First thing they do is lift their head. And that should be about 3 months. And then at 5 months, they're going from their belly, turning over to their back. And by 6 months, they're back into their belly. By 7 months, they're up and crawling. By 8 months, they're sitting up unsupported. then they're up and creeping, and then at that point, maybe by 1 year, they're trying to attempt to take a step, or maybe they've been walking since 9 months old. Remember, all children are different. If you have kids, do not try to compare this to your children. It's different, okay? Do not do that. It's one thing as a nurse I had to be careful with too. So one of the things we always do is height and weight. And we do that to look at nutrition. Are they getting proper nutrition? And then we look at cognition. Are they turning over, lifting their head, doing the things they're supposed to do, right? So developmental needs is when a child is not where they should be. For instance, if they're not turning completely over by 8 months old, that should be done about 6 months. That would be something that we would tell the physicians, and they would need some early intervention, physical therapy, occupational therapy. Just like a kid who's not talking enough, by 2, they're ordering speech therapy, right? Same thing. Kids are great. They catch up very, very, very quickly. So we know that of the nursing diagnosis and planning and implementation, all of this is documented. And what the neat thing I think is you're not the only person taking care of this kid. Usually the parent is there too. And some nurses don't go into pediatrics because of that. But if you teach the parent what you're looking for, what you're assessing for, what your outcomes should be, what you're going to do for them, and then, the evaluation of it all, guess what? They're going to be your biggest eyes and ears. So teaching this stuff. And then they go home and they're taking care of their kids the right way. So I'm always have been a teacher, okay? And that's what that's all about. Now, you're going to have a lot of terms. I think I'm going to send you your exam one worksheet when I send you your recording and your the Cahoots this week, because as a lot of these diagnoses, these terms that I want you to know about. Now, cephalocaudal. Well, I had cephalic, right? So it's what we call head to toe direction of movement, which means I lift my head, I turn over, get on my knees, creep, crawl, and walk. That's cephalocaudal. Proximal distal. Proximal is close. So first of all, they know stuff here, and then they start seeing everything around them and start grabbing for stuff. So cephalocaudal, proximal distal. We know children are different from adults. Just think about a heart rate on a brand new infant. It's 140 to 160 at rest. What is an adult? 60 to 100, right? So you need to know that those things are different for each age child: infant, toddler, preschool, school age, and adolescent. They're all different, and it's things we need to know. And their whole bodies, when they're younger, are immature. And as they get older, it becomes more mature. So these things are stuff that we do look at. So we do height and weight, and we do have all the standardization, growth charts and whatnot. There is a difference between boys and girls and their growth charts, but know that as long as a kid is growing, gaining weight, cognitively doing what they're supposed to do, we're good. And we know there are some kids who are tiny. That's my little Christian. He weighs 49 pounds at 7 years old, and he's a skinny little peanut. All right. And he was born at 7 pounds, so he should be a lot more than that. But cognitively, he's in gifted first grade. I mean, it doesn't get better than that. So we have to put all the pieces together, not just the growth. Yes, he's a slow grower, but the rest of it is working. Now, there's something called a Denver Developmental Screening Test, and it's not one of those IQ tests. It just evaluates if you need some sort of therapy. It's looking at, are they where they should be, or do we need to say they need physical, occupational, speech therapy? That's what it means. Again, it's not an IQ. It looks at their development. Are they where they should be? Now, some of the factors that can influence growth and development is their heredity. Mom and dad, are they both short? Well, you're not going to be tall, right? Your nationality and race also have a difference. The ordinal position in the family, which means, are you first, second, or third? I mean, I was number 6 in my family, but I have 6 brothers. I'm the only girl. I was second to end. So it really doesn't make that difference. But if I was my brother older than me, he did have more issues than I had. Absolutely. So it does make a difference. And boy, girl, there is a difference. And of course, were they born in a happy home or was there an abusive home, et cetera, et cetera? So remember, families are important, and those are going to take care of your kids, and they're the one that's going to help this kid grow. We know that some families need more help than others, and as nurses, it's just an intuitive thing as we work with them that we'll know. We know that children of homeless, and it's a reality, or you're one paycheck from homeless, and that's super reality. Know that it has an impact on the child, on their cognitive, on their health, development, because, homeless, are they eating right? Are they getting proper medical care? Are they brushing their teeth the way they should? Are they bathing the way they should? Et cetera, et cetera, et cetera. But as nurses, we have a lot of tools in our hands. We can say, hey, get social work up to see this kid. They need some help, and we can get it for them. Personality comes from what? Well, it comes from the way that they were born, okay, but also their environment, their family. They're going to sort of absorb what the family is. And then there's some of their own little quirks that come in there, right? I think you've all heard of, oh, my first kid was easy one, but the second one, oh my goodness, give me run for the money. And that's normal. Now, your first exam has about 7 theorist questions. I'm going to send you some YouTubes on them. I think they'll help. The ones that we look at closely are Erikson, Freud, Kohlberg, and Piaget. And then you need to know what Maslow means. It's a hierarchy of needs. What's the first thing everybody needs? Everybody needs to eat, have a place to sleep, right? That's number 1. And then it goes up to building your esteem through, you're good at sports and playing sports. So understanding that. And I think when I send you this test worksheet for exam 1, this is going to help part of it. So parents, how do the kids know what's going on? There are parents that don't bond with their children. I've had children, with congenital anomaly, like cleft lip. When you see a newborn born with it, it's hard to look at their mouth because their lips are open and the gums are there and there's no teeth. And, parents, have a hard time with that. As a nurse, what I would do is focus on other things, like look how much hair they have, or look, we've got big feet, or oh, look at those big cheeks, something else, okay? And it does actually help. So, and what it says is to encourage them to touch, all right? Now, one of the things infants do is what we call a reflex palmar grasp. It's part of fine motor skills. Fine meaning fingers, what you do with your hands. And there's a reflex where you put your hand into you put your finger into an infant's hand by reflex, they'll close it. And sometimes a parent just had that baby hugging them is what they need to get that close and that bonding. Now, Erikson talks about trust. Now, why does an infant need trust? What does that mean? Well, infants can't do anything for themselves. They can barely even turn over in the first, couple months, right? Just lifting their head a little bit. So what do? They do talk, as in they coo by 3 months, and they cry. right? First thing, they cry. When they cry, what happens? Somebody goes and picks them up and feeds them, changes them, burps them, whatever, talks to them, and that's trust. There are some families where they don't get it as quick as they should. So it's a hard thing because now these infants don't trust. So it's trust versus mistrust on an infant, according to Erickson. This grandparents taking care of their grandchildren, I had to be very careful because when my Christian, my last grandson was born, lived with me for the first over 2 years. And I had to be very careful not to do too much. And I had to be very careful, let my daughter do what she wanted. And I had, if she asked me opinion, I said, but do what you want. This is what I think, but I was not that mother who really felt that I knew everything. Well, I'm a pediatric nurse. I sort of do, but it's their child, right? Let them do what they want to do. Now, Erickson talks about toddlers. Now, toddlers are ages 1 to 3. Toddlers are like a blender with the lid off. You turn it on and they're everywhere. They're up into here, under here, around here, getting into this, and it's hard to keep up with them. They're all about me, 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 mine, 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 right? So they're autonomous. This is Piaget. Now, the problem is with that, you need to let them explore. But they're going to do something that's going to harm themselves, that's when you would stop. But there is this problem where some parents, grandparents, don't let them try anything. And this is not going to be good for the kid. They need to try as part of what we say Piaget. Now, as we get older, it goes into initiative where preschoolers like to help and do things, simple tasks. And that's very important for them to go and to let them be helpful. Whether they're getting dressed and their pants are inside out backwards, it doesn't matter. Guess what? They did it. School age. Now, school age at this point is all about children and learning peers. Up to this point, family's the center. And as they get older and school age, you start getting their best friends in school and going to each other's house and joining clubs and whatnot together. And it's all about peers. Another thing, school age is that they need to be good at something. I was great at spelling and at math. I was horrible at handwriting. So industry is like the house they can build well. It's that industry that they know well. And the problem with you can't be good at everything, right? Like I wasn't good at handwriting, but I was really good, at math and at spelling. So we need to focus on what they do well. What they don't do well, we don't. And this can make a difference in, let's say, if you had a kid in the hospital long term, a school age child, ages 6 to 12, and they're getting bored. So you might get, let's say, a puzzle from pediatric hospitals are great. They've got lots of resources. There's something called Child Life that I worked with, and many stores would donate all sorts of stuff, toys, etc. So I'd say, we need something to challenge this kid, occupy her time, but we don't want it so hard that they can't do it and get frustrated. So instead of a 200-piece puzzle, maybe it's a 50-piece puzzle. You've got to look at what can they do, but you challenge them, but what they can't do, you don't want to frustrate them. So that's basically, letting them know what they can do, what they can't do, feel good at. But, children will try, especially school age, over and over and over again. Now, adolescents are all about figuring out their identity. And this is again Erickson. And he talks about who am I? And it's like, do I like girls? Do I like boys? Do I like both? What do I want to be when I grow up? What school do I want to go to? Am I a band nerd, a sports nerd? What group do I fill in? And body image. What do I look like? Is my hair short? Is it long? Is it freckles? I mean, am I skinny? Am I fat? It's all of this stuff. And remember, they're going through puberty now at the beginning of adolescence, 12, 13, 14. So it's a hard time, really, really hard time. At this point, these kids need to learn how to make mistakes. But parents, they don't want it. It's difficult. There's a lot of communication issues, but parents do need to be there in the end, because kids will make sort of mistakes or do things they really shouldn't have done. And who are they going to come home to in the end? It's always going to be mommy. So again, Erickson, it's all about being able to do things and to complete things and feel good about those things. Now, Piaget is all about thinking. So let's take a newborn infant. So you have a reflex grasp and you put a rattle in there and they're holding on to this rattle. And all of a sudden they move their hand and they hear a noise. They go, "Ooh, I like that," as they get older, right? So cognitively, when they get it again, they know if they rattle it, they'll hear it. And then all of a sudden it goes in their mouth. Oh, and infants love everything in their mouth. They explore the world in their mouth. So now they put it in their mouth because it's a self-soother, right? So you see how just a reflex grasp, hearing the noise, and now we're working with the shaking. It's sensor oral motor, where we try to figure out things, all ages of play in children. And we're going to go into more of what these things mean. It's just learning more and building on it. And we know most of the younger children, they have to see it to understand it. They are not going to anticipate or intellectualize what it's going to work. No, young kids have to see it. It's the formal operations of adolescence where they can figure out how to get out of a paper bag and get out of trouble. I mean, that's just what they do well. Younger kids don't. They need to see it concrete. Now, Kohlberg, all I want you to know about Kohlberg is all about your conscious, knowing right, knowing wrong, and knowing that there's a consequence for each, okay? And as they get older, this right and wrong is going to be how do they fit into society, whether it's with their peers or in school or the rules of the school, etc. So these children, need to know it's really just right and wrong is what this is saying about. Now, some children, you know, don't understand that we have a body like a car. It needs gas in order to function. Children need nutrition to fuel their mind and their body. And so it grows, the muscles are good, your central nervous system, and then you can think cognition. So we really need to be teaching, parents all about good nutrition. In the beginning, newborns, how many of you seen they vomit a lot, spit up a lot, and their nutrition's going away? And then you get them to that 6-month visit, and you're seeing that they haven't gained double their body weight. Well, if you're not filling the tank with food, cognition, they're going to be delayed. Now, can they catch up? Most of the time, but we need to teach it from the very beginning. We never on heavier kids, and the younger kids we restrict fat and cholesterol, okay? What we'll do initially is just have them get up and exercise more, all right? That's really what we need to do on these sort of children. And we know that school-age children are really good about teaching them. We don't feed enough, number one. That's why we do height and weight every visit. They're not going to gain weight. And when you feed them too much, they're going to be too heavy. And that could be just as bad as not enough because it does other problems to it. Now, fats, when you eat them and there's too much, you're going to see a lot of gas, abdominal distension. It's just part of what it does. We know carbohydrates does the same thing, but it's also big weight gain. And if we don't have a balanced diet, too much fat or protein, again, it's constipation or could be diarrhea, either or of them. Infants at birth for the first 6 months are only on breast milk and iron fortified formula. And then after that, they're going to be on whole milk at 1 year old. And it's not low fat. Again, they need the fat for their central nervous system. They should be able to feed themselves by the end of the 2nd year. Now, they're going to start with a spoon upside down, backwards, wrong side. But at least they're attempting. That's all that matters at that time. By the end of 2nd year, they're getting it a little bit better where they can get in there. Kids love finger foods. I mean, Christian to this day, I go, would you use your fork? You're 7 years old now. Cucumber is one of his favorite foods. Picks it up, dip it in ranch. I'm like, would you use your fork? But, that's what kids do. We know that we have to be careful again, food, empty calories. Kids will just eat candy all day long and forget about real foods. But remember, they need the protein, the calcium, and the vitamins also, okay? And we know that kids are always burning a lot of energy. They're up and around and moving like crazy. And we know that if they're not eating right, they're not going to be that active child. They are going to have more fatigue for sure. You do have we used to have, but it's in your Calculate with Confidence books. It's all about your BMI. And this is just talking about, where your weight is. Is it obese or not? We know that children who are obese can become adults that will have high cholesterol, high blood pressure, and maybe even diabetes. Okay. Kids who are sick, how do we feed them? Well, number one, when a kid is sick, children don't eat. I mean, us adults, we don't care. We're sick, we're still going to eat, right? But the children won't. Now, we got to be making sure that they're getting their nutrition. And what I say is if we can, if it's a fever, let's give them the ibuprofen, the acetaminophen, keep the fever down and give them sips. Maybe they need to have juice, drinking that, apple juice, more juicy juice, not just that sugar juice stuff. And we have to be sure, look at the mouth. Sometimes they've got sores in there and they don't want to eat. But nutrition is always going to be something we have to be concerned about. A tablespoon of food for each year of life is all they need. So we think they need this whole big, pile of foods. They don't. A kid, especially an infant who can't eat. And we don't usually place infants NPO or nothing by mouth for long periods of time because their blood sugars drop. But to satisfy that oral need, give them a pacifier. And there are some infants who can't eat at birth because of disconnects of tubes and stuff. Make sure, or they've had surgery, give them a pacifier. It does help with their developmental needs. We know that their teeth are going to come in, and baby teeth need to be taken care of too. And we know that the baby teeth, about 6 years old, is when they start coming out. Brushing after, meals, not every kid's going to do it, but at least morning and night, we would say after each snack, each meal, but realistically, is it going to happen? I would at least encourage, in the morning and then, of course, before they go to bed at night, right? They should be brushing their teeth as soon as it comes in. Sometimes it's just a washcloth on it. It's all they need, all right? And they say that fever doesn't happen because they're having their teeth come out. Well, I hate to disagree, But when children teeth, most of them do have fevers. Maybe it's because they have a viral illness at the same time, but most of the time you'll see those things. Again, using soft type of toothbrushes and making sure we change it frequently. Kids are getting sick frequently. It should be changed after they're sick, right? Now, play. Play is the most important thing for children. It's that sensory, oral, motor exploration. Talked about the way things feel, the way things in the mouth, because they explore through their mouth, the way it moves in the air. It is so, so important. One of the things about children, is this playing gives them that creative, keeps them figuring things out. And we want those sort of things. Just make sure what we're doing is appropriate. For example, you're not going to give a big puffy toy that could have dust on it to a kid who has asthma, right? That just makes sense. There's all sorts of problems that we can have. All right, just be aware of it. And again, some of these things can affect their teeth. Bulimia, if they're vomiting with bulimia, it's going to rot their teeth, one of the things. And it's not anorexia nervosa, it's that bulimia. Now, infants. We've gone over some things already with this kid. So, what are normals? Well, they're going to sleep a lot. They're going to smile, right? And one of the things that they are going to have, and there is a discussion question coming up all about separation anxiety. Usually babies, they don't want to be anywhere except with mommy or daddy or grandma or whoever they are there all the time. So they're going to go through stages of it. And we'll go into that a little bit more. One of the things that we need to be concerned and teach parents is what a kid should be doing and what they should be looking for. I mean, we do give immunizations 2, 4, 6 months, 12 months, 15 months, 18 months. So we're seeing these kids quite regularly. So hopefully we'll be able to figure it out. Again, knowing what the normal vital signs are. And I'm going to send you a sheet on that also. As I said, their mouths are huge. This is how they comfort, pacifier, little sugar water if you're able to do it. It provides pain relief and it comfort. It's quite good for them and it keeps them calm, all right? That grasp reflex I told you about starts with voluntary and then it reflex and it becomes voluntary. So these are things. Prehension is, when about 5 or 6 months old, they're able to turn, et cetera, et cetera. Parachute, they fall down, they put their hands and feet up. Ever put a kid down into a crib? They put their hands and their feet out. It's what starts about 7 to 9 months. And then the pincer grasp is where they take the little Cheerios or puffs and they do one at a time. Starts out with a smush of a crude one, and then it gets into just a little pincer. Kids like to know what's coming. They love routines and they want that trust. They want to know when they cry that somebody's coming for them. Okay. And that, again, part of what Erickson is. We know children who are crying, they should be picked up and soothed. I mean, they may not be hungry, they may not need their diaper changed, but maybe they need you. Maybe they have gas. Who really, really knows? And no two infants are the same. Identical infants, they're both different, so make sure that we don't try to compare them to each other, right? Now, what do we do for nurses and what do we do to help? Always it is teaching. As I am doing something even to an infant, I'm talking, especially if a parent is there. And what am I listening to and what am I hearing and what I'm going to do? And because, again, they're going to be your next set of ears. We know there's irritable, lethargic babies, and these are ones that probably are that mistrust. They don't, really trust what's going on. Depends on the environment and the family. Maybe there's too many kids. Maybe, there's some sort of, alcohol or drug abuse or homelessness or whatever going on. So there's many different things that can cause it. With these children that are really irritable, and they shut down. Number one, they want to be just sat there and to rock very easily and very quiet talking. They love to be snuggled with the blankets really tight. It gives them comfort and to do everything slow and again, pacifier, right? Colic is big. It's usually lasts till 4 or 5 months, and it's painful and it's hard because the kid hurts and the parents don't sleep. It's a very difficult thing to work with. I've already said that. Newborns during the day and at night should be sleeping about up to 4 hours. By 4 to 6 months, they can go even more than that. Remember, if you were a night nurse and you were pregnant, guess what? That baby's going to sleep during the day and be at night like you. You have to switch their circadian rhythm. And I found that out with my second child. And no, she didn't want to sleep at night. She wanted to be awake because that's what I was doing at that time. So again, we've got to sort of put them where they need. Remember, infants should be on their back. It prevents SIDS death, okay? Should be a firm mattress and nothing in there, all right? Give them a pacifier, and that's what they need. One of the things, kids are going to get all the health checks and vaccinations. If they're not sick, they're going to get them, etc. And sometimes, if we see little rashes on babies as we're assessing them, find out, do they always have a rash or did this just happen? Changing that diaper more frequently, putting an ointment on it, because kids who get diaper rashes at night, if they stool, they urinate, they're going to be crying because it's going to burn. So you're going to lose sleep, and so is that baby. And again, nutrition. So we know children, as I said, they're there. We see them at birth. 2 weeks later at the doctor's, 2 months, 4 months, 6 months, and 1 year. That's 6 times during the first year that they have been seen, minimum. And that's if they're not sick. And we're going to be doing all different things. We're going to be checking them, usually they do hearing before they go home these days to see if they can hear, unless we're seeing symptoms that showing that they're not hearing. And then, of course, making sure, are they gaining weight, nutrition, etc. Again, early intervention, these kids are great. They catch up really, really, really quick. Immunizations are important. I know there are some parents who don't believe in them. That one thing that it causes us as nurses is that we must be able to put on a mask, protect ourselves, and protect other children, because a simple upper respiratory could be something that's quite bad, like pertussis, and that spreads very easily. The parents should be told to make sure that they keep really good records of it. At 6 months, they've already had iron fortified formula or breast milk for the first 6 months, and then we start adding food. The first food we usually add is rice cereal. And why? It's the easiest digested. So this is the first thing. We do one food at a time every 4 to 7 days. And if we don't see vomiting, diarrhea, abdominal pain, rashing, we know that the kid tolerated it. We can add another food, okay? And at first, have you ever noticed a kid, you try to give him a spoon in there and the tongue comes out at you? That's called a tongue excrusion. And after a while, they'll learn that that tongue needs to stay inside, but it's part of their learning. Again, teach parents about foods, what's important. And remember, there's different cultures. Some cultures don't believe in meat, right? Making sure if that's the case, are they getting enough proteins, right? We got to make sure they get proper nutrition. So making sure that they understand about foods. We know that children, when they leave the hospital, especially if they were in the newborn ICU and we're measuring every little, that goes into them, every ounce of it, every ml/cc of fluid. They go home and now they don't have bottles. It's all breast milk now. And they don't have a scale to see how much they're putting out. Remember, as long as they're having 6 wet diapers a day, they're gaining weight and they're sleeping and peaceful children, we know that they're getting proper nutrition. That's the whole thing with that. As I said, human milk for the first 6 months, and that cow's milk, whole milk, is at 1 year, okay? Prebiotics, we know that these are given usually, I've seen them, children get diarrhea, and you're still going to feed these children. You're not just going to put them on liquids because they're still going to just have liquid having diarrhea. So you give them food, you're going to give probiotics. And once we see that stool tightening up, we know they've had enough. Safe bottles, very important. Teaching parents they need to really clean those in between, and to keep them refrigerated, look at expiration dates. And they do say not to save formula in between feedings. Another thing that they came to was no heating up a bottle in a microwave. And why do you think that? Oh, well, you heat it too hot, you put it in a baby's mouth, you're gonna burn it, right? So if you put it in hot water. If a kid is sick, you're not gonna do anything different than what you're doing, okay? You should not mix cereal or food in a bottle with formula. What they want you to do is give food first, and then afterwards feed them their milk. They want them to get more nutrition through the foods, the fruits, the vegetables, the meats, the cereals, and then put the formula in. And there are high allergic children. My grandson is allergic to nuts, like pistachio nuts, walnuts, and he just immediately throat starts swelling up and wants to stick his hand down his throat. So that's one thing to be careful with. But orange juice, fish nuts, strawberries, chocolate, and egg whites. They're actually starting now to say putting egg yolks, starting that earlier in children within the first year. But again, this is all something that we know. These are things that causes a lot of allergies. As I said, solid foods before milk, because we want to make sure that they're getting a proper of the food before we just feed them up with milk. Now, children need a lot of calories. We need fat in there, and all has to do with movement, has to do with their brains. And the reason why we don't feed them any food, cereals, before 6 months is that their digestive tract is not mature enough. And you'll see the food literally in the stool. If you give them foods before 6 months, you will see it in the stool, okay? So we should encourage breastfeeding. Not every mother can do it, so at least early intervention, right? Of giving them the formula, the iron fortified formula. Again, making sure that they don't try to give them food on the spoon, solid foods before they should, because their bodies isn't ready for it. You know, children, when they're ready, especially if they're breastfeeding, they're going to start biting the nipple when they want foods. And some mothers are like, oh, my nipples are destroyed. It's because now they got teeth. So again, I mean, it's difficult. And many parents say, okay, I've had enough of that. We're just going to give them food. Let me just give them formula for the rest of the year. But it's a parental choice, whatever they want to do. Make sure everything is natural. You don't want these herbicides and pesticides. Be very, very careful with it. So reading food containers are good. And again, I already said food should be before feedings. Feeding skills, as I said, by 6 months old, they're giving it. And we know after they get that tongue protrusion stopped, they're going to be starting munching because that's what they do at that point. I've already said these things. Rice cereal is the first. Again, try to put it in the back of the tongue. And again, introduce one at a time every 4 to 7 days. Now, car seats. Car seats on a newborn up to the age of 2 should be rear facing. Now, what happens if they're 2 and they're still 25 pounds? Because that was Christian. He was little. He was a little kid. We asked the pediatrician. It was his muscle control that they were concerned about. So at 2, we could turn his seat around. So it was not the weight there, as long as it was a properly fitting car seat. In fact, we kept him in a car seat till he was 6, only because he fell asleep. He leaned over on the seat instead of over on the the cushion, because those little boosters, there's nothing to hold them up there, right? So, but anyway, that's, a choice. Again, always be careful, kids fall. One of the things that I said is they turn completely over by 6 months. So putting a kid on a couch at 6 months, they're going to roll over and fall on the floor. So be careful on a table, on a changing table. Make sure that we're using those locks, etc. Toys, make sure they're proper, that they're not little parts, because everything in the mouth, they will choke. So here's some developmental changes. Weight doubles by 6 months, triples by 1 year. At birth, these infants' heads are bigger than their chest. By 1.5, they should be at least equal, if not the chest getting bigger than the head. Mommy initially gives the baby lots of iron, and it's usually burnt up by 6 months old. That's why we give iron fortified formula. And that's why we start feeding them food at 6 months and getting some iron in there with some green vegetables, right? When they're born, each eye works differently. It's called binocularity. And then about 9 months, they work together and now they have depth perception. Because up to that, they can't figure it out because the eyes are working separately, okay? And remember their teeth, maybe 6 months, you'll start to see them erupting, and it's maybe 1 tooth per month thereafter. But my kids never had teeth at a year old. And at 15 months old, they got 8 at the same time. And all of that's normal too. So remember, all kids are different, right? And now you got toddlers. Toddlers, I love toddlers, ages 1 to 3, dive bomb kids. These are kids who want to be autonomous, me, mine. I want to do what I want. And again, they're not growing as quickly as that infant. They're slower. They now are walking, and it just becomes more graceful as they go on. The hard part is maintaining safety while allowing them to try things. The one thing that I found, just having, my grandson in the house, was he liked to get on top of the couches and jump off and go to the other couch, or jump off to, the coffee table, which is a soft sort of coffee table thing. And he wouldn't even think about it. He would just go. And one time he fell off, bopped his head. It does happen, but he never did it again. What if we always told him, you can't do that? Again, that's going to put him into this, shame and doubt, like, oh, I can't do that. All right. And now they're not, mind doesn't think they can try things. And we want to keep trying that. These kids love rituals. They love routines. They don't like changes, and they do much, much better with that. Birth weight is quadrupled at 2.5 years. I said at 3 years, it should be tripled, right? It's now 2.5 years, it should be quadrupled. We know that these children are going to become more graceful. The baby fat's going to lengthen out, the legs, the arms become more. They're going to be able to bladder and bowel control. It's all part of it. Their respirations and their heart rate's going to go down some, depending on where their age is. And we know baby teeth should be in by about 2.5 years. Their body has become more built up with antibodies against sicknesses because what do toddlers do, especially if they're in daycare? They trade toys around, and I call it they swap spit all day long at daycare. And this is a bad thing, good thing, right? You want them to build up immune system, but it's just what they do. You can't stop it. So we're going to see a lot of these upper respiratory ear infections, et cetera, going on, but again, the body's building up. They're eating more. Their defenses are getting a lot better. They're becoming able to walk without falling, and they're starting to understand things. They try things, don't work, they'll try it again. Again, this is part of these children getting, older and understanding more. They can be away from mom and dad more. They're starting to understand more, and they're starting to be able to understand why things happen on a very minimal things. And now they're trying to copy what other people do. We know that Freud talks about this is, their anal stage because now, they're going to be going through bowel control. Remember, one of the things we don't think about, children flushing the toilet think that parts of their bodies are being discarded. I know it sounds crazy, but they think these things. For instance, if they cut themselves and they're bleeding, they're screaming and yelling because they think their insides are going to come out. But a Band-Aid cures it, right? Especially when you get to preschoolers. They're starting to understand more than they can express, but they're able to communicate a lot better. And it's frustrating, but they're trying harder with it. So one of the things that we do diagnose in the toddler's age is autism. We might have clues before, but definitely by about 2 years old, if we see things like they're not talking, they are, not playing with other children, we're going to know that these children will need to be tested. I mean, many of the autistic children are boys, and it's usually at that 2 year stage where, they're diagnosed. And then hopefully, other things have happened and they're already in some sort of um, physical therapy, occupational speech therapy to help catch them up. In children, we don't punish them. We just tell them, let's go on a timeout. 1 minute per year of age. And we need to tell them what they did wrong and tell them that the clock will start when they stop crying because they're always going to cry when they're told to sit in the corner, right? So that is part of it. Temper tantrums, they love, especially in the grocery store, right? You go down the grocery store, you let them out of the cart, they want to grab something, you're telling them no, and they just flail on the floor, right? Temper tantrum. What should you do? Actually, should walk away because you're giving them attention if you stay there, unless they are in harm for themselves. Okay, those things, of course, you'll pay attention to for sure. Remember, children want to hear they've done good, and we know these children, if they're overcorrected, it could lead to emotional abuse. So children do need good job, when they take their shoes and put them where they should be, go, oh, good job, because these young kids, simple commands they should be able to do. Children being alone, toddlers, they don't like it. It's just part of their fears. So as they get older, they do outgrow it, okay? With everyday care. Children, they wake up and they eat, and these kids need to also be able to try to put on their own clothes. As I said, it doesn't matter if it's backwards. They've tried, right? And of course, don't forget these kids. I mean, I live in South Florida. Sunburn protection is important. Be careful of shoes, that they're not too small, okay? That they should be not too big, not too small. And that they should be decent shoes that they do wear. It does affect their posture. As I said, toilet independence, as Freud says, it's the anal stage. And again, usually they get bowel control before their urine. It's just easier to control. You should use a potty chair if they have it, and be careful with these kids. They can fall in. And the one thing that I found with boys, especially on the toilet, if you turn them backwards facing the bowl, their penis points down and not out and all over the wall in front of them, and it actually works better. Give them a name. Are you going pee pee? Are you going poop? What are you doing? Also their names. Is it a vagina and a penis? They do say today to give them proper names. They do need good food. And up to 2 quarts or 24 ounces of milk they should have, no more than that. And again, only 1 tablespoon of food per year of age. Toddlers don't need much. They don't gain up till 2.5 years, right? So they don't need more than what you think. I think it was one of those ages where my husband used to help us watch, Christian at this age. And I'd come home from teaching all day and he'd go, he's hardly eaten anything today. And he would describe what he had. And I said, it's more than enough. He goes, no, you need to eat something else. We need to find him something to eat. And I'm like, no, he's good. Don't worry. Again, there are picky eaters. Some kids don't like certain things, just what it is. And we know as kid gets older, be careful about those feeding disorders, anorexia, bulimia as they get older. Daycare is something that has to be done by many families. There's nobody else to watch their kid. So just make sure that you're getting one that's approved, right? Something we need to tell our parents. Make sure that it is state approved if they're going to go into one of these facilities, if it's not somebody that you know yourself, right? Kids have a really short attention span. They don't like to play toys with other kids. They do something called parallel play. One kid plays here, one kid plays here, different toys, never together. But remember, they're going to do things with those toys that you need to make sure that they're safe with them. It's very important that children understand other people beside parents. So a lot of these kids go to dance classes and gymnastics and stuff like that. It's actually really good. Daycares, it helps them, get used to other people. Because getting older, that's what life is, right? Injury prevention. As I said, this kid, the blender with the lid off, turned on everywhere. You got to be very careful. They're curious. They want to see. They want to look. They want to touch. So trying to keep your house safe. Some of the things that the government comes up with is non-flammable sleepwear. And if you've ever read it, it goes, it can't be too big. It must be more snugger fit type things. Of course, medication bottles. Kids love to open and explore everything. And to make sure that the cribs are up to date, there's a lot of older ones out there. Their slats are bigger. And what does that mean? Their heads can get through, and kids have strangled and they have hung themselves in there, along with those cute little bumper pads that I used to have my kids in. They don't want them there anymore. They don't make them because they've hung themselves. And of course, car seats. Car seats should be, new. They shouldn't be from 10 years ago, and they need to be placed in the cars properly. Again, make sure the toys are proper, that they're not going to hurt them, that it enhances their skills. Toys are, the things that the children learn from, and they learn how to play by themselves, how to play with others, and just try to make it as safe as we can. So, a lot of stuff, huh? Any questions? Who would
Nope.
like to? Who wants to win a Kahoots today?
I like that game.
Is that you, Roland? You want to
Yeah,
win?
sure.
I'm with you. Why not? As I said, Roland, what I do with every single class, we always have a Kahoots. And this Kahoots is going to immediately test you on what you just were lectured on. Some of it I also have as a preskewer to next week, something to think about. So I'm introducing it first, and then it again, because then it must be one of those important concepts, right? So what you do is, if you look, 1 second, it'll come up shortly. You see that little code? Put your cell phone on there, take a picture, and go to that website. I just learned it was like that last quarter, believe it or not. And I've been using this since, at least 2019. Now, I don't care if your questions are wrong, that you don't score well. What I want you to do is, as you're doing the questions and you're not understanding it, write a note to yourself. This is something I need to look at a little closer, okay? And you're going to find you guys are going to get really competitive as we continue through this quarter, all right? And we're about right on time tonight. PNR204 week 1. It's going to go by quick.
I was not able to get on. It
The
wouldn't let me
nurse
see it.
explains that permanent teeth begin erupting at what age? That's okay. If you can't get on, at least look at it and try to pick your answer.
Oh shit.
Okay,
Sorry.
it's not a problem. It's about 6 years old.
Not my-
Christian just
Oh.
turned 7 and he hasn't lost a tooth yet. And his mother's like, am I going to have to go to the dentist to get these all pulled out? I says, look, they're getting longer and they're separating. They're going to be coming out soon. Don't worry about it. What age range is considered infancy? And this is tricky. The reason why it is tricky, it's the first 28 days of life is considered their neonatal stage. Okay? So first 4 weeks is neonate. Infancy is 29 days to 1 year old. Okay? So neonate or neonatal time, like neonatal ICU, that's the first 28 days. And then infancy after. And you're going to see those terms used. That's why I put it there. A mother's concerned that her second born is not reaching milestones as quickly as her first child. What should you say to that mother? So the kid's not rolling over as quick. He's not crawling, creeping, walking. Teeth aren't coming out at the same time. Whatever she's saying, what are you going to tell that mother? Say it's absolutely different for every single kid. And as I said, even identicals will have different milestones, and it's just children. That's why I say if you have kids, please don't look at questions to think, what did your kids, what did your grandkids do? Because it's not going to be the answer usually. What food might cause botulism if given to an infant? And this is something that I have seen Hispanic families give to stop constipation, actually. My experiences here in Miami, there is a large Hispanic population, and it's honey. We don't know if it was pasteurized, bottled correctly, how long it's been on the shelf many times. So honey and Caro syrup, both of those, they are an old-fashioned type of thing that they do for the constipation. And I believe it's 2 years old where they say it's okay to do it. What characteristic of physical development best describes the development of an 8-month-old child? What should an 8-month-old be able to do? I did say it briefly in lecture. It's part of the gross motor skills that we do. Remember, gross is G. Get up and go, 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 like Paw Patrol. They should be able to sit alone without support. Doesn't mean all kids are, doesn't mean they don't do it earlier, but that's that medium time. Which milestone would the nurse be most concerned with for a 12-month-old infant during a well-child checkup? Well, that get up and go, go, go. Remember, it starts with lifting the head, then rolling over, creeping, sitting, crawling, and then walking. So if at 12 months old, a kid can't pull up to a sitting position, they're 4 or 5 months behind. What do you think we're going to do? We're going to start early intervention, physical occupational therapy. And those kids, they're great. They catch up really, really, really quick. And as nurses, many times, it's us who catches it. It's not the physicians. A multi. What technique should be used to soothe the irritable infant? That quiet, that irritable, they're not that happy cooing baby. I mean, it's everything quiet, everything slow. Give them a pacifier because self-soother, right? And they love to be swaddled. They like to feel secure. So swaddling is good for these children. So it's gentle rocking. And no, you're not going to change the position frequently. And if you are changing it, it's going to be very slow. A parachute reflex and usually appears in an infant at what months? It's when you turn them over and put them in a crib and their hands and their legs come out. Or if they fall face first, they put it out. It's like a cat, right? Hands and feet come out, but we call it parachute. It's right around 9 months old. Parents of a 2-year-old child report that he is inconsistent and he frequently says no. Well, a 2-year-old is a toddler, right? Ages 1 to 3. What are toddlers like? So this is negativism. No, no, no. Me, mine, 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 right? Don't play with any other kid's toys. It's only parallel play. Absolutely normal. At what month do toddlers usually recognize sexual differences? Like boys and girls.
Hush, Sammy.
It's about 2 years old. They're starting to understand the differences. And just think about it, kids who are being potty trained. A little girl sees daddy standing up and urinating, and there's a difference, right? Or what the boy's going, well, why do you have to sit down to pee when I can stand up, right? They're starting to understand there's a penis and a vagina, and that's the difference as they start to understand. What is the cause of most childhood deaths? And it's accidents. It's not as sudden infant death syndrome. We've decreased that by a lot by using the back to sleep instead of on their tummies or on their sides. It does really has cut that down. It's unintentional accidents. Just think about kids. They're getting into things, doing things that they don't know that's going to hurt them because they've never experienced it before. And it can cause those deaths. Things like crawling up the front of a chest of drawers to get to the TV to turn it on, and the TV comes over on them. I mean, I've seen these things, okay? It wasn't nice. According to Erickson, what is the correct stage of development for the toddler? Well, what are toddlers? Think about it. What are they like? And then you'll always know the answer to this one. Toddlers, me, mine, right? And there's mommy and daddy and grandma going, oh, be careful and don't do that. And you're going to be hurt. Autonomy. They're autonomous, right? Egocentrical. They're all about me. All right. That's autonomy. And that's what that means. All right. Trust versus mistrust is your infants. They cry, somebody comes and picks them up. And then the industry inferiority is your school age, but it's that autonomy, me. So think Erickson, autonomous. What guidelines should parents of a toddler follow when feeding solid food? A toddler. One tablespoon of food per year of age. And that's what it is. You know, it's not protein and vegetables. You need the mixture of fat and carbs and all that stuff together. But it is 1 tablespoon of food per year of age. And that is your guideline. And they should be able to feed themselves by the end of the second year, right? Which type of play is typical during the initial toddler years? I said it several times. So there's two different sort of plays here that are in the book and that you'll be hearing more about. Parallel play is toddlers, which means they're next to each other. They're playing with their own toys next to each other. They are not sharing. That's parallel play. Cooperative play is a group of two or more children playing together, and there's a goal, whether it's they're going to build a house together, or maybe it's a board game and somebody wins. There's an outcome. That is cooperative play. Parallel play is always toddler. A multi. Which characteristics are displayed when a child experiences separation anxiety? These are the young kids where mommy has to go and leave the kid there, whether daycare or in a hospital, right? Parents can't always stay at the hospital all the time with them. They have to work, there's other kids, many different things. And there's these 3 steps, and you're going to be doing this again in a discussion question coming up. Protest, detachment, despair. Initially, what does a kid do when they're left alone? Scream and yell and cry and mommy, daddy, I want them, I want them. And then they're going to go sit in the corner and they're going to regress and start sucking their finger. Regression, right? Maybe finding a pasty and putting it in their mouths. And then in the end, if it's gone on a while, it's going to go on for detachment. They're going to come in and they're not going to pay attention to mom and dad. And that's the 3 stages of separation anxiety. What is the most important nursing intervention to promote a positive hospital experience for a 1-month-old infant? You don't think 1-month-olds know what's going on? I'm telling you, they're very smart. They know sounds, voices, smells, feelings of people. If possible, you have a child in the hospital to have the same person. It's not another noise, a sound to get used to. Very important for that. I mean, if a parent can stay in there, I mean, that's what we want most of all, but it doesn't always happen for many different reasons. And it could even mean that what if the mother needs to go to the cafeteria to get food, right? So there are going to be some times that the kid's going to be left alone. So that consistency does make a difference. What are the best foods for the nurse to recommend for a 2-year-old child diagnosed with mild constipation? So you want to put some bulk, right? Shredded wheat, cooked prunes. I mean, prunes, come on. That would have to be it, right? Now, if you lived in Miami, they're going to tell you the rice and the black beans and some honey. But again, what is really the book, what it should be, those shredded wheat and cooked prunes, it will help them. Even children, young children, infants, they might even give a little bit of prune juice in the initial to try if they have chronic constipation. A group of children are observed playing house, each assigned a specific role, mommy, daddy, or child. At what age do you think this starts? Again, when you look at that, remember they need to know that there's differences in mommies and daddies, right? And kids. So it's not the younger child. It's your preschoolers, ages 3 to 5, 3 to 6. Okay, the younger kids, they're too young. When you get up to school age, they don't really play house anymore. They're doing other sorts of things together, but it is your preschool age. For how many weeks will the infant experience passive immunity from his or her mother? That means mommy gave me all these antibodies at birth in her blood. How long does it last? And it's about 12 weeks. This is about what, 3 months? And then it starts to wear off. So, why do you think we start giving these immunizations at 2 months? And we give a whole bunch of them because it's going to wear off. Just like another thing is babies don't make their own red blood cells yet, and they only have what mom has. So they're dying off. So hemoglobin hematocrits are going to be lower until the baby makes his own, somewhere between 4 to 6 months. So this is something to remember. The kids are 4 months old. Their immune systems are a lot less than they were when they were born, believe it or not. A multi. What characteristics are present in a well-nourished child? If you take by process of elimination, pale mucous membranes, the child has a low hemoglobin hematocrit. It's not well nourished. Protruding abdomen, they have too much fat, right? That causes flatus and abdominal bloating. So good shiny hair and stooling properly, those things you'll definitely see. So that's how I ruled out the other ones. A newborn infant will typically lose 5 to blank percent of her birth weight by day 3 or 4. You know, they're floating in fluid, right? So they soak up all the amniotic fluid and they come out puffy. And you even see the difference from when they're born and when they come back from the nursery after being weighed and bathed, right? Because they've urinated. And it's 5 to 10%. So a child born at 7 pounds could lose 7 grams of weight, right? It's just part of it. And we expect it. And then they start gaining right after there. What does self-feeding help to develop in the toddler? Remember, toddlers, me, mine, I do, right? It's that sense of independence. Very, very good. Absolutely. I want to do it all myself. I don't care if it's in my hair, doesn't matter, all over the floor. I'm going to do it. No, mine. I love toddlers. Why is the 4-year-old child likely to obey rules? And this is all about Kohlberg, the theorist. Okay? They're starting to understand having a conscience. They're starting to understand when things are good and when they're yelled at, right? They don't want to be punished. Children, and this is your preschoolers, they know right and wrong, and they want the praise. They don't want to be punished. So they try to follow the rules. Now, as they get older, they know when they need to break a rule, even if they're punished, right? They start to even think more about it. That's school age. But your preschoolers, they don't want to be punished. They want to behave and do right. What is the earliest age at which an infant is able to sit steadily alone? You know this one. So that is 8 months. And that's a guideline. I mean, if they're not doing it by 10 months, there's a problem. If they're doing it at 6 months, they're ahead of time. But both of those are okay. Very good. What is an abnormal finding in an evaluation of a 6-month-old child? Well, think about what I've even said about weight gain. When do they, how they gain weight? Talk about gross motor skills and how they should be moving. These are things that you take into consideration when evaluating an infant. One of the things that you should not see is a head lag. Now, do you know what a head lag is? Take a kid on his back, hold his hands, pick him up. His head should come up with him. It shouldn't flow backwards. That is head lag. Because remember, they should be able to lift their head up by 3 months old and have head control. That would be really behind. Again, early intervention, physical therapy, occupational therapy, catch this kid up. And maybe there's another reason why. Maybe it's they have a thyroid problem, nutrition problem, cognition, right? So that would be something that they would look at when they are delayed. How many hours should toddlers be able to stay dry for the nurse to suggest they are ready to begin bladder training? Because remember, bowel training comes first. So it should be about 2 hours, and if they are, then we can start thinking about it. I mean, I remember my one, daughter-in-law having her little potty chair out in the living room and having the kids sitting there trying to do it, because it was, easier for the kid and for her to be watching. That's the bladder training. They feel the stool more. How many minutes should a 5-year-old be in a timeout? Remember, you don't want to punish children. You want to put them on timeout to think about what did they do wrong. And it's 1 minute per year of age. Again, having them sit wherever your timeout place is, a corner here or there, and to let them know what they did wrong and to let them know that the time starts once they're quiet. And then the 5 minutes will go for this 5-year-old. 1 minute per year of age. What type of family consists of two parents with children from previous relationships? Remember, there's all sorts of families, right? Blended, nuclear, alternate, extended, two moms, two dads, adoptive, one parent, one mother, and their kids. And here, two sets from two different relationships. And that's what we call blended. And remember, a family is whatever these people tell it that it is. I mean, initially with my grandson, it was my daughter, her son, me, and my husband. And that was the family. I mean, she today has a wonderful husband. They just got married in Mexico in September. And he's adopted, her son. And that is now their family. All sorts of family. They're all good. An infant who weighs 6 pounds, 12 ounces at birth should weigh what at 6 months? Hmm. So remember, children who are born should double their birth weight by 6 months, and they should triple it by 1 year. So when you talk about this one, it's 13.8 pounds. Now, 12 pounds is a little bit underweight. So what do you think we need to do for that? If they're not gaining, they don't have the nutrition that they need, then you look at developmentally. Are they cognitively aware? Are they where they should be? And then maybe we need to add more calories to their food. I mean, there's all different, and I don't know if you know this. Formulas come, normal ones on the shelf are 20 calories per ounce. You can go up to 30 calories per ounce. There's formulas. And then you have fortifier that can make it even more depending on what weight these children need to be, because they need that weight. That's telling us they're getting the proper fuel for their bodies. And last question, what's an example of proximal distal development? So you talk about, you can move your arms before you can move your hands. It's what we call, you start with the front and then you go outward. So arms is before hands because the arms are closer than the hands are. Okay. Let's see how we did today. Number 3, Tammy, good job. Number 2, Mo, good job, Mo. Number 1, whoop, whoop, whoop. Yvette, good job. Number 4, Kimberly and Steffi. So did you enjoy the Cahoots? Did they help you? Did they give you an immediate example of things and stuff that you might see and concepts? I work hard at them for you so that you have them, as that understanding. And I do review them every single quarter to make sure all the concepts you need that are there. Remember, this week, what you have is 2 discussion questions. Make sure you do the technology quiz, et cetera, et cetera. Most of them were done. I think 1 discussion question wasn't done and one of the introduction ones. So make sure you do get them done so that you hit your Canvas shell twice. Now, anybody who needs help with dosage calc, let me know. I will help you. I'll set something up. And another thing I need is if you have accommodations for quizzes or exams, I need that as soon as possible. And I need the letter from the Vice President of Nursing, Elaine Foster, okay? If you do have it, let me know. Quizzes are at the beginning of class, so you'll have one next week on this week's information, okay? Any questions?
Nope.
No.
All I
No
got for today,
questions.
guys. Good job. Nice
Thank
to
you
meet
so
you
much.
all.
Thank you
Thank
so
you.
much.
Thank you.
My
Thank you.
pleasure.
Night,
Nice
thank
meeting
you.
you.
Have a good weekend.